Some of the things that you can do with a four-year residency program is offer the opportunity to explore your interest in emergency medicine. That's something that is really difficult to do in a three-year program because you just don't have the freedom and the elective time that you need to really explore your options in emergency medicine. So here we give you that opportunity by giving you an elective month in your third year, and then we give you 3 elective months in your fourth year. And so that third year, you can kind of explore some opportunities, some interest areas, do some international travel, and then in your fourth year, you can expand on that. You can go on trips for up to a month. You can go to Hawaii for a month. You can go do international medicine for a month. If your focus is on a specialty within emergency medicine, you can do that within our own program, or you can do that somewhere else. So that four-year system allows you a lot of flexibility. It also allows us to focus on one of our, I think, real areas of strength right now, and that's education. With 4 years, we're able to give you an extra month just focused on education. And so we're not educating you on medicine, we're actually educating you on how to become a better educator. And I think that's a great key for all emergency physicians. If you look at what you're going to do with the rest of your life, you're going to be an educator forever. Even if you go into community medicine, you're still going to be educating patients and fellow faculty members and committees and things like that. If you go into academics, clearly education will be a big focus of the rest of your career. So we actually spend a month now with our third-year residents where they come in for a full month. They get specific training and education on how to give a good lecture, how to create intriguing PowerPoint slides, and we actually do what we call alternative education block as well, where they either create a simulation module or they do some TBL, team-based learning, or whatever alternative educational modality they choose. And the residents get a full month to explore that. They don't have any clinical duties, and it's really been, I think, a great innovation for us. Our residents here get a graduate level responsibility, which I think is really important to your education. We don't just throw you into the deep end with the sharks right away. We do allow you to kind of swim in the deep end, but we put you with what we call our teaching resident. So for the last several years now, we've had a fourth-year teaching resident whose role is to kind of guide and mentor medical students and interns and junior residents with their patients. And this serves two great purposes, I think. One is that it allows you as an intern to take care of really sick people in a safe way. When you have that fourth-year resident there to kind of watch your back, you can take on a much more complex patient than I as an attending would probably be willing to let you take care of as a brand new intern on your own. And they can help make sure that the patient's staying safe while you're getting some great educational benefit out of taking care of these complicated patients. The other benefit is that when you become a fourth-year resident, you get to be what I like to call the pretending. And as the pretending, you get to kind of act like you're the attending working in our critical care area, taking care of these sick patients and guiding other people in their care, which is what you do as a faculty member. You know, everyone else serves as your hands, and you're kind of guiding the puppets, and you have to work with other people's knowledge and information. So it can be difficult to learn that skill, and you get a full year of that when you're here as a fourth-year resident, where you get to help guide other people. For the last several years now, we've had a teaching resident working initially 8-hour shifts, and now we've expanded that role to 16 hours a day. And moving forward, starting likely in the next year, we'll expand that role to 24 hours a day. So we'll have a 24-hour teaching resident supervising the junior residents. So that's really a great strength, and we really follow that graduated model throughout residency. So, you know, in the emergency department, you're kind of never left alone to take care of patients that you might feel uncomfortable taking care of, yet we like to give you enough freedom that you're able to make your own decisions and manage your own patients as you see fit.